States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I will recess the Commissioners' meeting at 9:05 a.m. so that we can call to order the Records Commission meeting. Christie?
Okay. Do you have anything to turn in?
I do not know.
The only thing that I have is from JFS. I have a RC2 from them, and that's it. Anybody else have anything?
No.
Okay.
Thanks.
Meeting adjourned.
Yeah, these are quick, to the point.
Okay, call it,
So you just submit that,
Yeah.
and then
We're in
we'll
the-
approve still.
So I'll send something back and then I'll send it to JFS and then they can, actually it's child support. Thank you very much.
so I'll call the, reconvene the Commissioner session at 9:06 a.m. Thanks for coming.
Boy,
Okay.
glad you guys made the trip out.
That was
Yeah.
Yeah, if there was a place to have a cup of coffee or something.
Yeah.
you know, say,
Yeah.
enjoy
Gotta
the
socially
scenery.
distance.
Shit, donuts at least, yeah. There you go.
Yeah.
Morning, Kevin.
How are you guys?
Good, you?
Good. And then a quick question for you guys.
Yep.
My question is, who should I talk to, or just want to pose a question? I have the contracts here for the American Road. I know that you guys are involved.
Yeah.
I'm involved, prosecutors involved. We have to keep track of this for our audits. We spend our time on this. And I'm pretty sure the city's going to tip this project, which means that for the next 30-some years,
We won't get taxes.
we don't get taxes on it. Why are we doing this work?
CDBG money.
But if you have a tip, you have a source for money, and you could use CDBG money for other projects that are not tipped.
That's gonna be a good question for Dennis Miller. We have, other than the papers being thrown at us,
Yeah.
that's all our involvement.
So he's the one I should call about this?
I would. Or Will Burns.
I will call. Okay.
Yeah, Wilburns is actually.
Because
And you're absolutely right. Why should we spend time on it? I mean, we're never gonna get our,
well, the city's not approved the tip, but I'm pretty certain they will. I mean, every indication I've heard is that they will, which inclines that we lose our taxes for the Love's Truck Stop, Paul Martin and Sons, anything else that's built upon there for the next 30 years. So I would like to at least have an explanation about why we're doing this work and signing these papers, because the TIF should be doing that, in my opinion. But I'll give them a call.
No, because we administer the CDBG funds.
But why are we administering those funds when the TIF is a financing source for the American Road improvements? You don't need CDBG funds if you're going to have a TIF.
Also, they're getting both, is what you're saying. They're getting the funding from CDBG,
Mm-hmm.
the $490,000 for the road, through CDBG money. That's why we are involved in this.
So
Because
then why are they doing the
administer
TIF?
Pardon?
So then why are they doing the TIF?
yeah.
I need to ask the city that.
That would be, Will and Dennis can answer that question. We have not been involved, are not involved in any of the deals
Well,
with the city any longer.
and that's the thing with the TIF, is that they don't have to involve us.
No, and that's with,
But it's our tax
that's
dollars.
with anything they do in the CRA. They can go ahead and do tax abatements and
But the difference with the CRA is that we're not signing contracts to improve the roads and keeping track of it. Now, the CRAs in my office, we gotta keep track of the lowering of the value and all that. But even a TIF, heck, I gotta create, on my end, it's not a complaint, I'm just saying that the work that I have to do on the TIF, and I have no say in it, we don't recoup it, but when we do additional things like this is where I'm just questioning whether, why should we be involved or not. So what I'll do is I'll get a hold of Will Burns and Dennis Miller to have at least an explanation before I sign these contracts, because we've not, in my tenure, we've not had a TIF before, and that this should just be stuff that the city deals with through their TIF, and we should be out of it.
The last TIF in the city was for this plaza.
Yes, yeah. So, okay.
Yeah, hey, you should at least get admin money for that. Just get a percentage for.
Well, and I don't know all the details, but like in some of the CRAs that we have in the city, the Napoleon Infrastructure Fund gets a payment.
Yeah.
So the people that put the CRAs in,
Yeah,
they get some payment.
they're creating income for themselves.
Through a payment.
Yeah,
And it's all legal, I'm not saying it's not.
yeah.
But I don't know so if the Napoleon Infrastructure Fund gets money back through this TIF,
Yeah,
maybe we should too, for our admin.
yeah.
There is admin money, on that 400, that net is 490,000, that is actually a $500,000 grant.
So somebody at $10,000.
From
Army Valley.
CDBG, Maumee Valley,
Oh, yeah,
gets the
yeah.
10,000, and we do, I guess I hadn't really thought about it, but I agree, Kevin, we do most of the work, and,
Yeah,
And we lose out.
and we lose out.
yeah.
We're
That's
not
a great
the only one that
question.
loses out. Like I can say, the schools really lose out.
Yeah,
But what work has the school done to this?
nothing.
Nothing.
They don't get anything for 30 years? They don't pay any taxes for 30 years, or they pay some?
You pay the taxes.
Yeah,
The taxes get diverted to the debt of the road.
oh, okay,
So for like Love's Truck Stop, they pay taxes like regular.
Oh, okay,
There are certain
That's
ones
right, yeah,
that
yeah.
do not get taken out.
yeah,
Certain levies are exempt from this, so
Yeah.
some entities get paid.
yeah,
But the schools, county, city, and those senior center, health department, things like that, they
all have to go to pay for that road.
pay for that debt.
Wow.
Yeah. So, I'm just saying that the work that we're doing, we don't recoup a lot of that. Work in it.
Exactly.
So,
In 30 years.
Hamilton and Claremont County have been raising
Bless you.
voices for the last 3 or 4 years in Columbus on some of this stuff,
mhm.
and it hasn't gone very far.
Well, the argument a lot of this is that what we're doing is we're arguing about future value. Like right now, we get nothing.
Yeah,
And I can agree with that. If we didn't do this, we get nothing. We got nothing beforehand, we get nothing now of new improvements.
Mhm.
And I totally understand that argument. But we're doing a lot of work for nothing.
nothing. For the good of the cause,
Yeah. And at the end of the day, I'll use the Love Truck Stop as an example. They're here. To my knowledge, there was no agreement that you're gonna improve that road all the way around and all that. I don't know if they really care, because they're still gonna have to pay their taxes regardless.
Yeah.
But that wasn't an incentive for them to come. The incentive is the off-ramps off of 24.
Yeah, right.
In the cement to their drives, the road to their drives, that's all they care about.
Yeah. So like if you do compare a CRA, now use the GMR Properties as a CRA. That was an incentive to get people to buy, to build houses.
Mhm.
Again, so a CRA is future.
Yeah,
Right? If we didn't have that CRA, would that be built? And so we got nothing to begin with, and we gained a little bit through a CRA.
Yeah.
For a future value on that.
Yeah.
But
But
we
those
gain,
aren't 30
we
years.
gain the full value, whatever that value is, out 10 years.
Out 10 years, yes.
Is that what the CRA is, 10 years? That's
10 years, because 10 years of 50%, because if they do anything else in the schools, and then others have to start signing off
Okay,
on that,
okay.
on that one.
Oh, okay, so, yeah, 10 years isn't 30, that's for sure, 10 years is.
So I can see where that, some of that stuff is an incentive.
Yeah.
The old senior center building, that was an incentive.
Yeah,
To
Yeah.
get,
yeah,
we froze that for 10 years, and in 10 years, she should be there and still, and that grows and all that. So she got that incentive to do that. I understand that.
yeah,
But, I guess maybe I get it more when I hear 30 years out there.
yeah. You're right,
I agree, Kevin.
So I will get a hold of them and just pose the questions about this.
Yeah, I'd say at least we got some administrative money coming back.
So
That's nothing compared to what we're losing, but.
Would the TIF be the rest of that road and they're gonna do Oakwood too, right? Part of,
I don't know.
Number 23 is Oakwood, 23 I think is Oakwood, 2023.
What is that TIF gonna pay for that too?
No,
No.
No, I don't think so.
that's a different.
Yeah.
You got a grant for that?
Well, the TIF could pay for to the bypass, maybe, because the TIF that I saw that they're looking at goes a lot further than what we think. It's 300 acres, and it goes clear to, what's his name, Shank's new
Yeah,
property too.
right, yeah.
It's included in that TIF. And a lot of it's farmland because of future development.
Yeah,
You're just gonna capture it, and you do maximize it, I understand, but.
yeah,
So, I will give them a call just to.
yeah.
Well, then,
Morning, Penny.
You don't have a good answer, Kevin.
Yeah,
Okay.
yeah, but you're right,
But, kind of looking at this recouping, talking about how can we recover
Yeah.
expenses from the CARES Act money, we just kind of let this is just kind of coming on.
yeah,
These things for,
yeah,
But like you said, 10, at the max you can push out an enterprise zone agreement. It's dicey, but you can go 15 years.
yeah,
But it's usually on that last 5 years is a reducing scale, they receive less benefit, and
okay,
it's really the way it should be written.
yeah,
You see the daylight out there that pretty soon it's going to be.
yeah. Well, 10 years, even 15 years, that's foreseeable future. 30 years,
It could be closed.
Yeah, well, that's what I'm saying, that could be wore out already, yeah. The life of that building, yeah,
This
30 years.
was closed, and Walmart was still paying it.
Yeah.
They paid the property taxes, until it was all,
Yeah,
it was
Yeah.
all taken care of. Well, they continued to pay it.
Oh, yeah, that's why,
Quit, but,
that's why the Walmart building itself, for years, we had it valued a couple $1 million
yeah,
because they were getting lease payments.
yeah,
And it was for sale for over $1 million
Yeah,
for
right,
years.
right.
And as soon as that lease payment ran out, they sold it for $300,000.
yeah.
Because
And now we
it was
can't,
income source.
and now that guy can't get rid of it, yeah. Yep.
Okay.
hey, Kevin.
Yeah, thanks, Kevin, good thinking, though, you're absolutely right.
Do we need three quotes on our river deal?
Yeah, I need 3 quotes. I'll have to go to Bass Pro Shop, Cabela's, and,
Yeah.
whatever marine.
Two lots, can't go to 2 lots.
One of Warren Buffett's company makes,
Although that cocktails in the courthouse resolution might be coming.
Cocktails in the courthouse? Yeah.
Hey, I'll just say this,
That's fine with us, because if it can be allowed at the courthouse, then it's allowed at the senior center.
For everybody.
Yeah.
I can tell you, I've been at the State House,
Oh, yeah.
and they have in that, what do you call that,
The atrium?
the atrium.
Yeah.
And I've been down in the crypt,
Yeah,
the basement,
yeah,
and it's, cocktails are allowed there.
yeah.
Yeah.
I'm sure if you go in a lot of offices there, there's a lot of cocktails.
Do ya think?
They actually rent that atrium out for wedding receptions.
It was something that we have chosen to do.
Things like that, like, alcohol free.
All right, thank you.
No, you can't negotiate deals without alcohol. And the Capitol Club, play basketball and stuff, they negotiate deals. All right.
It is what it
Well,
is.
Penny,
Hello.
Good morning.
when did you think we were ignoring you?
No, and just to let you know how my morning's going, because this isn't our normally scheduled time, but I thought, well, we'll just cover everything that way, I don't have to come back next week. And all your copies are on my desk of things, because we're too dry. I almost called you and said, I'm doing a route, I'm not coming, because I had 2 drivers call out today, and we can't get a hold of a third that is off but could fill in. So Sandy's like, I gotta do a route, and I don't know if Sandy and Bruce were very good friends with Dave Rohrbaugh. And so she's just kind of out of it anyway, and I was like, I really want her out on a route.
Yeah.
It's Sandy and
Mary,
yeah.
they're best friends since kindergarten.
Oh,
So I told her, I said, you take yesterday, take, today off and tomorrow. But she says, I'm better off here, she doesn't need me right now, so. Anyway, so now I think Sarah and Vicki, or just Sarah, somebody's doing a route, so. And then all this is happening right before I go. Well, Sandy was I've been bringing my dog to work. He's almost 6 months, and during my interview process, they said, therapy dog, we need, I used to do that with my old dog, so we're trying to get him used, so it's been a great time for him to get acclimated and stuff. But he cries when I'm not there. So right now, his kennel, and he's tied to Vicky's desk, so he's under Vicky. So he kind of takes turns in the office. But it's good for him to get used to me not being right beside him all the time, but yeah, it's like a zoo over there right now. So I'll email you reports on that, and if you want me back next week, I can come, but,
Really, what I wanted to do is, since Monday has come and gone, I thought we need to have at least a public discussion about reopening the senior center. And I still, Jeff, I forgot to send the link, But after mentioning that you'd been on webinar with area office, I called Mrs. Johnson, and they sent me that presentation from Ohio Department of Aging.
yeah. And we've had a couple more since, and we have another one tomorrow, and you have a board meeting tonight that I know you guys are talking about stuff. So still, what I thought we would know more of
I'll just here, you do it.
from Tuesday to today,
Way faster.
we still don't know more, because on Friday's webinar, I asked the area office at Aging to come up with a blanket press release for everyone, because no one in Northwest Ohio was opening. And they said they would, and on Monday I talked to Justin, and he was doing it, and then when I talked to Christy, I was like, so I should have it by the end of today, but it might have, so then he called me yesterday and goes, I'm really sorry, Mrs. Johnson decided she didn't want to do one until after her board meeting, so they're working on stuff, but, and then we have another, tomorrow morning, we have a Zoom meeting, just the senior center execs with the number 2 and number 3 people at Department of Aging.
Okay.
So not Director McElroy, but the next 2. So in that one, we can ask our specific questions for senior centers, because what they've done is they've lumped us all together, and they made us part of the long care facilities and the adult daycare centers. So they've lumped us all together and then made some of these mandates. We have to separate them out. Because yes, you need your adult daycare people being tested and those staff being tested, but you don't need your senior center participants being tested on a regular basis like you need some of those others, because your population is all over. You have a controlled population in those other two, where this could be anything, so.
Yeah, and I had, after I read through it, and then I have, sitting out on the deck, I think it was Monday night, and read through it again. I think I read through it 3 times, and then this.
And then the orders.
This is a more simplified, I think more simplified or more confusing. This was the one presentation that Penny was talking about. But it talks about testing was the big thing. And testing staff once a week, and then I didn't fully understand whether...
Volunteers.
And then, volunteers.
And strategic participants.
That was a little tad bit confusing.
And we said, so those are all our questions we keep firing back. And then they sent out a question and answer form, but it didn't answer half of our questions, so that's why we have tomorrow morning.
So I had Mark come over from the ELC, and my question to Mark was, understand the test. I understand we can get the test, you can order them in, and we've got the test. Who pays for it? No, we don't have to pay for the test, but who pays for the lab? The lab. Yeah.
And do we even have a price on that?
Well,
I don't even know.
He didn't know.
Yeah.
and that's where we had so many of these last week. So the state came out and said, yes, we are paying for it. So then we had a whole webinar with this Mako, and that's the lab that we would use. And how we would do it, how they would send you the supplies, they would do this, they would do that, then you send them in FedEx, and it sounds all neat and tidy. And then at the end, they say, and then this is where, when you fill out this is where you put the insurance information, and this is where you put this. So we started firing back those questions, and of course, this is a webinar, so you can't get those interactions right away. So Autumn at Area Office on Aging had this long list of things that came from that webinar that we all asked, and we're waiting for those, and that's why we're hoping tomorrow at 10:30, because, I'm not gonna have some, so Medicare might pay for one test. Are they gonna pay for ongoing tests? What's that gonna do to our insurance if all of a sudden I have 22 staff people getting tested that many times? Because then the other thing they said in the one webinar was that the state will cover it till the money runs out. So money might run out after 2 tests.
2 days,
And then it comes back on everybody else, but the order is still in place that you're doing this. So that's where we're saying, that's why even people that had thought about October openings have pushed it to November, and most people have said indefinitely. I brought you like the Fulton County Commissioners, they had a quote on their newsletter they just sent out about, we don't know what to do. So there's so many unanswered questions. Then they said that they'll send staff people to train our staff to take the test. I am not doing that. I am not going to test seniors and the rest of my staff. I'm not doing it. And then the PPE that we would have to have would be unimaginable, because we'd have to have a gown and the mask and the shields for every person.
For every person you test? Oh, jeez.
So right there is 100 sets of PPE that I need each month if I run it every other week. So these are all the questions that we're hoping.
You want to scare seniors away, tell them I got to test you every time you come in here. They ain't coming.
And that's why I wanted to have this discussion, because it really comes down to...
Well, and that's why I was looking at the papers here, because I was like, please don't, just let us talk first before they start.
Yeah, but this is what I wanted to get to. They may be on, but we need to let our seniors know why.
Yeah.
And You know, when you look at the other stuff, the card playing, basically card playing's out.
Yep.
You could play pool, but one person's up at the table, another
Yeah.
person's standing against the
Yeah,
wall.
but then they're touching balls, and
They're
they're
touching balls, yeah.
unless they bring their own stick, and then
Yeah.
pickleball, they're sweating on each other because they're running into each other and they have the same ball.
Mhm.
Do they still, do the CDC still think that it spreads that much on the surface? Obviously they do, they don't want you.
I don't know.
Because I would almost think, and I said this to somebody the other day, if this spreads on the surface, and I go and get a pizza, and I drive up there and pick it up, how many people touched
That
that
box.
cardboard box?
Yep.
And I've taken the cardboard box home, throw it on the counter, and eat the pizza out of it. You know,
Yep.
everybody has done that already.
Yeah. Do you get-
Shouldn't we all have had this already? I mean, boy.
I think with some of these, even some of the events that we've had here, is the air handling systems can move it.
Yeah.
And you can have you can have it really filtered.
Yeah.
That is so fine that most filters will not stop this virus from getting through. So a closed loop system,
Yeah,
which many places have,
yeah.
will just
Yeah.
move it around, and case in point is out over by Okolona.
Yeah,
How did all those people,
yeah, yeah,
and we know the one event here in town at a nursing home is somebody that was infected was walking around, and
yeah.
When you go to the hospital, we talked that they put you in a room and they turn this huge, it's like something hooked up to like the filters or something. They turn it on to take all the air out. I think St. Paul got one of those too.
Is that that light that,
no, you can't be in that light.
No, this is,
It's a filter, there's a
It's a
filtration
it's
system.
huge.
Yeah,
It's huge.
yeah, I think the light, isn't the light in the filtration system? That's what
It may be.
That's kind of what I understood, but I don't
See a
know.
light on that. I didn't.
Yeah, you could even set those up like in the senior center and they would,
Right, well, that's like with the
Filter.
mask and stuff,
Yeah.
they said that they could do
Yeah.
that.
It's gotta have something else.
Yeah.
So it would be a UVC
yeah,
light
Light.
source. That it's our understanding that does work, that it does, well, it kills most things.
yeah.
And hospitals, because of staph infections and the way the infection rate was going for a while, they have units that they move into the rooms.
That's what this was
And
like.
into the surgical suites, and it's not an air hand, it doesn't move air. When you have somebody in there, you need something to move air. When you're sanitizing or sterilizing, say, a surgical suite, you put this light in, and some of them are robotic where they move around, so when the light flashes, it can get in under,
Yeah.
under the tables and in places where
This is also lost in space,
Yeah.
Wi-Fi, sucking all that bad air out, putting it in a canister, and picking it up in space and letting it go, and I go.
So kind of getting back to where we were,
Yeah.
is the testing alone is enough. I wasn't excited about saying even November.
I know.
Somebody said to me, when we were meeting with Mark, one of our brain trust people, so what are you saying, the first of the year? I don't know.
Well, and that's, then I'm like, and then do you do it the first of the year, because that's our lowest attendance months in the middle of flu season, do you wait until March?
Wait till March.
So it's like, yeah, and we don't know, and that's just it. If this testing part wasn't in, I would be more, I would be, you know, there's everything else I would be thinking. I'd be thinking of ways that I could really do controlled things, and that's where we were going. And this was just the loop, you know, this was the one that just killed everyone's plans. Because we knew we were gonna start out with grief groups, we're gonna start out with the caregivers groups, we're gonna start out with mental health groups. Those were gonna be our controlled settings that we could get in first, and those were the people that need us the most. And this is the thing, that those are the people that probably won't come then if they're being tested.
Right.
Plus, I have probably 4 drivers I'll lose if I have to test them that much. Because they're like, I'm too old to go through that, and, we've, been doing this for this long, all of a sudden.
And now all of a sudden you want to test us? Yeah.
So, and that's what, quite frankly, a lot of us are afraid of now that they put this in. Are they gonna go back and say everything you were doing, you still gotta test?
Yeah.
And that's where Mrs. Johnson says, you guys just keep doing what you've been doing, keep doing what you've been doing, and we will fight
Yeah.
for you to keep doing what you're doing. And
she will.
but when the governor, and, when they say on the press conference, sure, they can open on the 21st, that's all people hear.
Yeah.
And then when we have the webinar that says, this is what you have to do to
Oh my
open
God,
on the
yeah,
21st,
yeah.
it was like, no one hears that. They might hear some testing and they hear that word, but they had no idea what the intensity of that was. And in the spirit, it wasn't true, what he said. So.
You're right. I agree. It appears that we're trying to get back to normal, but
Yeah.
we'll let you know at a later date what the list is of.
Yeah. How many of your seniors that come there on a regular daily basis, is that the only place they go? Is there, I'm sure there's some of them that's basically all they do is go to the senior center.
I would say at least a couple dozen.
No kidding.
Oh, yeah, anyone that comes on public transportation,
Yeah.
they come there and then they might go to the grocery store or to get their hair done or something like that. But a lot of people over here at Mills Apartments, they're the only place they come.
Yeah. Wow.
And, we're up to 2 or 3 people that we're talking to on a daily basis now. We were at one, then we added another, now we had another, and then we got a couple that we talk to at least weekly. So
Yeah.
I would say, now we've lost a couple of those that it's the only place they come. We lost Mary Borchak, we lost John Eddy,
Yeah.
there's somebody else, and those were people that was the only place they came to.
Yeah.
And so, but we have, people are hurting and we know that, but
Yeah.
it's like,
I didn't realize that, that's why I asked, I'm just
Yeah.
curious,
Yeah.
because you might wanna think, we're telling them they can't come there, but they're uptown eating at the
Yeah.
diner, or they're up some.
yeah, and
other
there's lots of them too,
Yeah,
which is fine and great too.
Yeah.
But,
Yeah,
there probably is,
yeah.
I can probably name 12 right now, and I know there's more that I don't know that, because they don't come every day.
Yeah,
But
right.
they come a couple times a week,
Yeah, so,
and we know that they're not out there any more than that, so.
Would, and you probably thought of this, Penny, since the number is fairly low, that needs the extra attention, needs this, really, it's more socialization, isn't it?
Oh, yeah.
Would it make sense to make home visits?
actually, so that was one good person.
Then you're putting your staff in a weird predicament, because.
But it would be additional, it would still be maintaining social distancing. But at least.
We have done that with the bus, and they, we meet outside. So that we could do with a couple of those, and those people we have,
Okay.
and with the one, has a social worker that will take her to the grocery store and stuff, because she used to use transportation from the senior center to do her shopping, and I think they might help her every once in a while, but she does have like a social worker. And on her birthday, the social worker brought her to the senior center, and we all went out in the parking lot and took balloons and stuff like that. So we are some of that, but I guess.
And these are people with no family.
Right.
Yeah.
And that's where, like right now, Charlotte has spent probably 10 to 12 hours trying to help this lady who wants in the senior housing by us. And English is her second language, She's 87 years old, and every time she calls them, they need more paperwork. She has no family here whatsoever. Her power of attorney is Shirley Distel, who is 97 years old, and so, because her other power of attorney passed away, and so, you know, she has nobody. And so Charlotte's been back and forth, and almost all of this comes down to when they gave her an email address to send stuff to, somebody inverted, and she has where they wrote down the wrong email address for her. So she's been months of this stuff back and forth, and so we don't know who she's been sending her social security number to, who she's been sending some of her financial paperwork to. So, you know, that's the kind of stuff that people would come to us that we do, that no one in the county knows that we're doing this.
Yeah.
Charlotte's been
right,
almost, you know, better half a week for her, because she
Yeah.
only works 30-some hours a week, helping this one lady figure out why she can't get into this housing.
Yeah.
And that. So the other part about doing some of the home visits is that we know those, but we also have to be really careful, because what if we miss somebody?
Yeah.
You know, and
they
it's
find
like,
that-
they came to see them, but I just lived 2 houses down and they didn't come to see me.
Yeah.
So I know we have the most vulnerable, but maybe there's somebody out there that's really struggling that we don't know. And that's why we try in our radio show, we try in our phone calls to always say, if you need anything, reach out,
Yeah.
reach out.
Yeah, if you don't tell us, we don't know.
Yeah.
Yeah, yeah.
So it's a lot of damned if you do, damned if you don't,
Oh, yeah.
same with opening,
Right.
you
Yeah.
know?
Mhm.
Well,
And
this,
then-
this whole thing is a little bit like that, you know?
It is.
You can't,
You know, and the other stipulations, if you read through the order, if you open too, it's, you know, limited hours, limited people, limited this, and then how do you pick?
yeah,
Is it a random draw?
Yeah,
Is it the
right,
first 10
right.
people at the door? Is it you can only come one day, you can't come 2 because we have to get everyone one day first?
yeah.
It's just, I didn't sign up for all this. I mean,
Yeah,
come on.
right, no, right.
None of us did.
None of us, yeah.
So I just feel sometimes like I'm judge and jury deciding, you're gonna get tested, you're gonna be allowed in, you're
Yeah.
not.
Yeah, wow.
So,
It could be a while before this goes away.
so I think we're doing okay telling people, you know, that we're trying our best. But Glenn, I think if we wait till after your board meeting tonight, we wait till after this webinar tomorrow to see if they start to separate the senior centers from these other things. Senior center directors in Northwest Ohio are praying that maybe this mandatory testing goes away for us. And if that does,
That would help.
you know, and maybe it's a baseline testing of all our staff once,
Yeah,
and then we,
yeah,
you
you
know,
know, and then instruct people if you don't feel good.
Yeah.
Then get retested or,
it's like we had somebody call out sick today. And all I'm thinking is, well, does she have a fever? Well, should she get tested? Well, you know, is it something she ate? Is it, you know,
yeah.
and it's like,
Mhm.
I didn't ask any of those questions, I just know we had to get her outfit, you know, filled first,
Yeah.
and then it was,
Hmm.
yeah.
Well, I kind of already in my mind knew what, as far as reopening, what the answer was going to be. But we needed to talk,
Yeah.
and there's really, we don't have any answers.
We don't.
No.
And, yeah.
And I think my radio show on Monday, I said, you know, I said, today is the day that some of you thought the senior center would open. What you don't know is
Mhm.
that mandate, you know,
Well,
that came with all of this
Yeah,
stuff.
that testing, if I had to be tested to go there to eat lunch every day, I wouldn't go, I'd say, nah, ain't worth that, you know, because that test isn't
Yeah.
pleasant to.
Well, and then
Yeah.
if you might have to pay for it.
And then you might have to pay for it, yeah,
Yeah.
Because you
yeah.
don't know, that's
Yeah.
the first time,
Yeah,
if your insurance is
Yeah.
gonna be somewhere.
And I haven't been anywhere.
yeah,
Why do I?
yeah, why do I, yeah, yeah.
Yeah.
Yeah, this whole thing from the get-go is set up wrong, I think.
This demographic is one that's gonna be really difficult to deal with.
Yeah,
Very difficult to deal with.
And, you know, we were getting ready to do some, you know, tried to do some outside stuff, and they put a kibosh on that and told everyone that was doing outside stuff that they couldn't do it anymore.
Yeah.
You know, that came from the Department of Aging, the Area Office on Aging, that they said no. So Pauline kept doing some of the things she was doing. She only had, you know, 3 to 5 participants in some of that stuff, but the rest of us didn't start doing it because we were told, don't do it. So, and, you know, like I said, we've managed a way to do the toenail clinic, and area office and hygiene is fine with that. We're going to do it between the 2 front doors, one at a time, masked up, clean everything in between. And they know we're doing that, and they haven't told me to stop that. And Mrs. Johnson says, continue to do what you're doing. I'm like, well, that's what I'm doing.
And just, it's always just maintain a low profile, and
Yeah.
we will take care, we'll, on that toenail clinic, we'll back you.
Yeah.
There's no,
Yeah,
And,
you gotta be done.
what's that?
The toenails gotta be done. You gotta.
Somebody, I mentioned that
Yeah.
in a small group, social distance setting,
Mhm.
people ask, you're kidding. No, I said, that's a real concern
Yes,
of our
it is.
seniors.
Yeah.
It is.
A couple hip surgeries, you don't do that stuff anymore.
Nope.
Right.
But, and talk about infections and everything else,
Yes.
especially people with diabetes, and
Yep.
it is a
Very
big deal.
important, very important.
And the doctor charges them $55 to do it, if they go to the foot
Oh,
doctor.
yeah, wow.
So, I don't know, I think they pay 10 or 15, I think it's just 10 that they pay.
What would be, for the sake of the board meeting tonight, what would be, say, your number one concern?
Well, the testing, I mean, to reopen,
Yeah.
it's the testing. Yeah, because anything else, I think we can be diligent and work hard with it, but, and then my next concern is just, I'm still scared.
Yeah.
Still scared
Mm-hmm.
because you can tell them the social distance, you can tell them that this is what's gonna be, but
Yeah.
they're gonna see each other and they are all gonna run in for a real hug, not a air hug.
Mhm.
And that's where, you know, we've already talked as a staff that if and when you see anyone, and, you know, they'll come to the door and we'll go out and talk to them and stuff, but they'll come up and we're like, you know,
Well,
we're just
if
asking
they
you
have been
to,
going to the churches, they don't, you know,
Yeah.
they usher us out, you know,
Yeah.
of course, we all stand outside and talk.
yeah, So-
But it's outside,
But it's outside, yeah,
which is,
yeah,
which is different, yeah.
okay.
yeah. Did I give Sandy a hug yesterday? Yes, I did. She needed it, and we've been this close for the last 6 months, so
Yeah,
if I can hug my own family, I can probably hug her, because, you know,
yeah.
but, yeah,
There's just certain times where you have to say,
yep,
forget,
yep,
and do something,
Yeah.
and that's it. And I'll mention, are more at risk, the ones we do know, and it's being difficult to deal with, let alone, the ones we don't.
right. Well, and I know Justin had asked me after we met today, he says, I'm putting together some slides and stuff, if there's anything you can share after you meet with your commissioners, he says that I can, you know, share, but I did want you to, Fulton County Senior Center, it says we, John, is it Roop or Rupp, how do you say it?
John, he's Ruth.
Roop. I know there's different ways, you don't want to say it wrong.
Yeah, he's on the side that doesn't have money.
Oh, okay. He's the worst.
They make the joke.
It says we hate keeping the senior center closed, we miss having our facilities open and active, and anxiously await the return of our seniors, but priority will always be providing the best experience for them. To provide the best experience at this time means we must consider their health and the environment they will be in when at our facilities. Knowing at this time we can't meet some of the mandated guidelines without some additional clarifications from the State Department of Aging and the potential risks that are at stake because of COVID-19, tells us that we can't offer the best experience for our seniors. Therefore, we will remain closed at this time. I thought it was very well written.
Yeah.
And if you want us to do something, we will be more than.
So, you know, and that's where I'm thinking.
I think right there, copy that. That sounded pretty good.
And even if we gave him credit for it and just say, you know,
Yeah, and we're.
totally agree with
we
Fulton
totally
County
agree.
on this.
We totally agree with Fulton County on this and just,
And, but they had a case where, and Sherry's really gun shy because they had a senior, that wasn't feeling well. So she went and got tested. So something happened with the testing in her nose. And so she had a really bad nosebleed, could not get the nosebleed to stop, so she was hemorrhaging. So she had to go in, she had to have surgery. She says, so now this lady who, you know, wasn't positive, she tested and she was not positive, was in the hospital alone with nobody, you know, that can see her.
Yeah.
Had to go to a long-term care facility. And then I can't remember exactly if she did then get COVID and died of COVID or if she just, but she died alone because she had to get tested for something else.
Yeah.
And it was a test that went bad that led to something that led to something that, and so Sherry's like, there's no way I'm testing people.
Yeah.
So,
There's a risk when you have people on blood thinners.
yeah.
Oh, I never even thought of that, but you're right. Yeah,
No, that's a big,
yeah.
No, I didn't.
Yeah.
You brought that up.
Yeah.
I didn't.
No, that's been a big concern in all our talk about the testing is like, because they want us then to do that. I'm like,
No.
they go, well, we'll train you. I was
They
like,
go up to your eyeball.
huh?
It's quicker, I mean, they go high.
Well, this one, they say that's just the one that's down at the bottom that shows
Yeah,
the full video.
Annie said there's two kinds now, they can do the down at the bottom.
But I still don't, what if somebody sneezes, what if somebody moves, what if,
Yeah.
I said,
Yeah.
I'm not,
Goodness, then to a lot of
Yeah.
other people.
Mm-hmm.
I'm not gonna do that.
Wish you could ask them to pick their nose and rub your booger on this and
Well, even
I mean, as long as they all do it themselves,
Yeah.
then you can't trust it.
Yeah.
Starting to have nosebleeds because it's just, he's so dry up in here.
Yeah.
And, yeah, just once it gets started.
Yep,
Yeah.
but like she said, this lady was perfectly healthy and then ends up dying, and
Yeah.
whether it was a COVID death or not,
Oh, they'll count that as code.
because of COVID, that all this
Yeah.
started because of the testing.
Mm-hmm.
And I can't remember why she had to get tested to begin with, if it was she didn't feel good, if it was something, you know, but, yeah.
One thing led to another and boom, she's dead. And died by herself, that's the sad part, you know.
So,
But even at the nursing home, if you're dying, the family can't come, so they're moving them to hospice, where they got a special area set up for your family to be there with your loved one.
That's really a good place to be.
Yeah.
So the hospice places are incredible.
Oh, yeah.
You know, what they do.
Yeah. I mean, that's,
They understand the science of dying.
yeah.
Which is kind of, real,
Yeah.
but they do.
They can get it down to the hour.
and that's like with Dave, you know.
Yeah.
Yeah, they went home at like 11 or so, and they called them back at 1,
Oh, yeah.
and it was 6:15, so they knew.
Wow.
Yeah. So,
Yeah, they had, for my father-in-law, hospice came to, the assisted living side of the Lutheran home. Lutheran home said, we'll just keep him, they had space available,
Mm-hmm.
we'll just keep him there, there's no sense of moving him over, this was last year, to,
Yeah. Yeah, I remember.
to the nursing home side, and it was a week.
Yeah.
Okay, Penny.
All
I
right.
think this was, thank you for coming out.
Yeah, no,
It's
thanks
just,
for-
we needed to talk about it.
Yeah. Yep, I think hold off right now, I agree.
Indefinitely.
Yeah.
Well, I got this via email, I can forward you a copy of the
Yeah.
Fulton County one, and we can,
Mhm.
we've been holding off on, even doing our October one again, because
Yeah.
as soon as we put it in and we send it in, something's gonna change, and,
Yeah.
It might be good for me to get, say, Jim, sit down and do an interview with you,
Mhm.
just, maybe sometime next week
Yeah.
after we have these other meetings.
Yeah.
And, still many of the seniors, they get the signal, or their
Yeah.
presidents, if
Right.
they get it in both,
Yep.
I think that would be the best way.
I could put you on my show if you want to too.
Yeah, I think that would be.
Yeah.
I'm going to actually be recording here, right on my calendar, Tuesday, next Tuesday. What is today? Today's
Thursday.
the 24th, yeah. Yeah, I'm gonna do Tuesday afternoon, I'm gonna be there at 2 o'clock. The
Well-
29th, yeah.
We need somebody.
I don't know if I'll be ready
You don't
by
know.
then, just depending on what comes tomorrow, and
What
then
comes up?
prepare.
Well, here it is, Penny, if you wanna go on my show, I'm gonna be there interviewing, Laura Rolfe anyhow.
Okay.
So if you come up there.
Okay,
they will
well,
let
you
us
know
know.
what, or maybe, with some of this stuff, maybe a Charlotte, to
Okay, that's
just
fine.
talk about mental health, or if you have somebody on that can talk about mental health, but gear it toward the
Yeah.
senior population. I
Charlotte.
mean, mental health for
You
everyone.
want Charlotte to come up there? Tell her.
Yeah, and if she could, or like I said, if you have somebody from
Yeah.
Adams Ward or anybody, but
Yeah.
if you could focus on that right
Yeah.
now for people.
Yeah, okay.
But that's what, we've done in our phone calls off and on, and September was Suicide Prevention Month, so we
Yeah.
talked about, some of that too. But,
Well, you know what, I know Rod Gieseke would come anytime I'd ask him, so if Charlotte don't wanna do it, call me back and let me know.
Okay.
But if she
Charlotte's out
wants to.
today, so I'll have to ask her.
Yeah, okay, then, but it'll be Tuesday, this is Thursday, right, yeah, this is Thursday, so Tuesday afternoon, I'm at 2 o'clock, just let her know that, and if she can be there, if she's not, I could call Rod Gieseke, and I know he would come over. Cause I interviewed him about a year ago, and it's about time for him again.
Okay, yeah, because that's, just to tell people, there's people out there that can help them. There's, there is things they can do. They can call the senior center.
That's a good idea. I think that's,
And through our CARES Act money that we got through Area Office on Aging, we have money that is actually billable, that all those phone calls and that, we track those, and that's, some of our CARES money is earmarked for our calls.
why not? Because
So-
that's,
For cost recovery.
Yes.
yeah.
So,
I think that's good, because that's what it's all about here, I mean,
so,
We should be receiving shortly, as soon as the governor signs the bill, the last of the local government CARES Act money will be here.
okay.
So we're kind of on the last run. If you think of anything,
My biggest thing right now would be, is if I have to have extra PPE, if we have to do any of this testing stuff. But I'm hoping that we're not doing that, so I'm hoping not to worry there.
fortunately, that is in pretty good supply.
Okay. And,
We have
mean-
stuff stored that we've got from the Strategic National Supply, so we're in pretty decent shape.
Yeah, well, I'm glad everything's going well.
and I thought I was good too.
Looks like the commissioners,
Go ahead.
looks like the commissioners are joining us. As soon as they get,
Check it out, just
their volume going.
or just,
Here, thank you.
or you could just stop your video, just, yeah.
No, that's fine.
Okay. Okay.
Yeah, so, as far as from what Tracy has said and Mark Adams, we're in pretty good shape.
And I feel that we are too, because I sign up for masks and stuff whenever I can get things, so I have several cases of like, just some Hanes ones. I thought I ordered like 500, I think I have 5,000. I don't know, because I got a box one day, and then the next day I got like,
MASH, yarny things.
Yeah.
We only needed 5,000 tongue depressors and 500,000.
Yeah.
all of a sudden I got this box, I'm like, yes, this box came, it worked, whatever I signed up for worked, and the next day, like 4 or 5 more boxes came, I'm like,
Uh-oh.
I'm looking at the label, I'm like, well, they still say our name, you know, because I'm thinking, who did they mess up with? So, you know, so I feel that I have those that I can give everyone, and, you know,
Okay.
I could give everyone a pack, because there's like 3 in a pack. And then we have, you know, some of the surgical ones, we have some hand sanitizer, different things for area office on aging. So I guess the biggest thing that we're seeing is our expense line is the packaging stuff. And that's, you know, I've used our CARES money to get things that help us in the kitchen, you know, strategically and operationally, but now what it's coming down to, what's costing us is the trays, it's the packing supplies, the paper bags. Whereas a normal month is usually about $20,000 to $22,000 in expenses, we're running about $29,000 to $30,000 because of those supplies. So over a year's time, you know, that adds up. So I don't know if that's something in the next round of the CARES that I could put in, you know.
I definitely think.
But
That's what I was gonna get the legwork started on, to see if that is.
It's because people are quarantined, they can't come out, so you know.
well, and then even our grab and goes though, even if they can come out and they come to the senior center to get lunch, that's what we're putting them in.
Yeah.
So normally that would be on plates and we'd be washing those and everywhere.
Right,
Now, that's everyone that comes through, you know, is getting those.
So I'll mention that to Tracy, and have him at least start looking through. Some of us know the guidelines almost by heart anymore, but we sent a question down to Columbus 2 days ago that threw them.
Oh, yeah?
They hadn't heard this one yet.
Oh.
And so we get, and what's nice, Tracy's not afraid to go to Columbus, you know, email Stacy down there and say, hey, is this a qualifying? And the last one from this week, she said, well, I'm not sure. That's a good question. So if you need anything from us, we're more than happy to assist. I don't want a statement for you know, the newsletter, or sitting down with Jen or Todd from the Crescent News.
Yeah.
One of us will be more than happy. Or you can go off your own and on your own, and you know, just so we can assure. I think our seniors is that the commissioners understand and are in support of what we're, you know, like. Yeah.
That's why it'd almost be better if I had somebody, if you or Charlotte would do that, but if not, I can get, you know, that way, this is Charlotte from the seniors.
Well, you know, like, so if she could do that stuff, and then I could come on maybe the next week or something, or whatever we're doing, and then we can talk more about this.
I got room right now if you wanna get on, so.
Okay. All right, well, thank you guys for your time.
Vicky will be happy that you're back.
We'll see, either that or.
Or you get here and find out there were no problems.
Yeah, let's pray for that one day. He is cute as can be, though.
What breed?
He's a Yorkie poo.
Oh.
So he's a little 10-pound
Yeah.
jet black, so his name is Jet. And just black eyes, black fur. Just. But he'll be 6 months old on the 30th, so
they're so cute.
he'll just chew on everything, so.
Yeah,
The bottom of the chair,
table.
Be great when the seniors get back in there, they'll love that.
And he knows
Yeah.
who he said their desks. Sandy and Vicky,
Make
yeah, he knows who he said their desks.
Yeah.
Thank you.
See you, Penny.
We'll get another cup of coffee.
Okay, go ahead, I got one here, yeah, I'll get enough heartburn from this one.
No, go ahead.
Let's start it up. We're back. Oh, you can't see me.
Can't read that.
Go, yeah.
Chris, what do you want with these contracts? You're gonna give them to Hannah?
That's Ally.
All right,
We're here. I gotta go.
you're there. I see you.
Yeah. Here comes our auditor, he's coming up too.
No, I'm leaving.
Huh?
I'm leaving.
Oh, you are? Okay.
You want me to stay?
Oh, no, you can, no, you can stay if you want to.
Did she talk?
Okay.
Good morning, everybody.
Morning, Cameron.
Morning.
Cameron's on the side of the road.
On the side of the road.
I pulled over, I didn't crash or anything.
Yeah, there you go, there you go. Good safe driver.
That's right.
Yeah.
I did a meeting the other day on the side of the road, but I held up my camera in front, or my phone in front of my face and talked into it, yeah. And then they could see me. But you can't see me now, can you, Alan? Just the same.
I see it. I can hear you.
Yeah.
I can hear them.
Yeah, I'm right there, that's me, yeah.
Yeah.
They keep me away from everybody else, see, they're all over there.
There's a reason.
I understand.
Yeah. Yeah, I take a shower every morning and everything, but.
Good morning.
Good morning.
Okay, well, Glenn, you missed it. Cameron's on the side of the road, so he's on, but you just can't see him. Are you guys ready?
Didn't really want to today.
Yeah.
No offense, Cameron.
Yeah.
Hey, that's okay. I don't want to bring the meeting down or anything.
Yeah. Well, we know what, your next meeting, Ally, is at 10:30 for Williams County?
It is.
Yeah, I saw their agenda last night on Facebook, so that's why I know.
You know, yeah, we're a little full today, yeah. So you guys ready then?
Yeah.
Get started? Okay. So I am going to share my screen, so you'll be able to see the document, hopefully. Give me a second here. Go Cameron, sorry Cameron.
There we go. Oh, I like that.
Okay. Well, first, I'd like to thank everybody for taking a few minutes to meet with Cameron and I today. Normally, we would present this at renewal time. This is the stewardship report, which highlights the risk management services that Henry County participated in 2019. You know, as you know, this year being a little different, April, May, when we would have come out for a renewal visit, that's when everything hit, and we could not make our visits this year. But I'd first like to thank Cameron. You know, the agents this year, with, of course, the staff not being able to come out and see everyone, they really had to, you know, make sure that the renewal process was finished up with our members, communicated their numbers and so forth, and so I just want to thank Cameron for doing that little extra stuff for us this year. This year, with our stewardship report, we decided to highlight, with it being 2020, this year we decided to look back at the last 10 years and give you a little bit of historical data also. And so on the first page, you will see the chart that is titled Annualized Total Program Costs. And this is the program cost for the last 10 years, and it reflects all 66 members. So keep that in mind. This is for all 66 members and how the program cost has really stayed pretty steady. I mean, there's been a couple of little hiccups here or there, Part of those, the two high ones are really, in 2013, that, was weather related, and, sometimes there's just something you can't help, and, but I really think overall, you always hear us talk about the power of cooling. You'll probably hear me make that statement again yet this morning, but, this really defines, this is a good definition of power cooling and how the program costs have stayed relatively stable, is what I want to say. I mean, there's no really ups and downs, and so I just think, this really defines that statement of power cooling. Now, keeping in mind, especially like the last 3 years, there really has not been any, it stayed pretty flat. And with that, the next page will highlight, and again, this has to do with the program as a whole. Force's total insured values over the last 10 years have gone from $8.9 billion to $13.4 billion. Wow. So not only has the program cost stayed pretty stable, but the total insured value has increased quite a bit. And along with that, we've also highlighted the coverage enhancements that we've added since 2010. And as you're aware, at Corsa, we are always trying to help our members as much as possible and try to implement a new coverage enhancement each year. Over the last, 4 or 5 years, we've, really stepped it up with the drone coverage, land banks, cybersecurity now is a, big one these days, and each year that's changed a little bit. And then also taking on the elected officials coverage for your surety bonds. And so again, you need to keep in mind that even though program costs haven't really trended up too much, we've still been able to add some coverages for our members. And so I think it's just, full document is just a great way to show what power cooling means. Mm-hmm. So now the next page, we are going to highlight Henry County in particular. And so over the last 10 years, this is the look at the premium cost for Henry County. And I always kind of joke, I do not have the graph backwards. This is correct. The premium has decreased in Henry County over the last 10 years.
Yeah.
And I just would like to note, the leadership with the Corsa board and so forth, and their foresight, in 2015 to 2016, there's a big decrease. And that was actually due to the time that the Corsa board decided to not just go out. They decided to change their reinsurance carrier and go with a reinsurance pool. And so, again, power cooling has helped us, lower our costs for our members and on the reinsurance side. So that was the big decrease between 2015 and 2016. As you can see, your costs were really, I would even say, the last 4 or 5 years have really stayed pretty steady. But keep in mind, over the last 10 years, Henry County's total insured value has increased also. Yeah. Gone from $55.6 million to $83.4 million. And I'm not sure about you guys, but my property insurance increases. If my value of my house increases, my property insurance is increasing. It's definitely not decreasing. Yeah. So again, I think this is a great chart to show you in the power cooling.
If I could butt in there, Allie, for a minute, sorry. I think that graph is pretty significant in what you guys as Corsa have done for the county, because on a normal commercial property coverage, if you went from 55 to 83 million, your premium is going to increase significantly for that. And property rates right now with our other carriers are going up anywhere from like 3 to 10% on the standard commercial side. So it's pretty awesome, really, that you guys are able to keep it. It shows your financial strength that you're able to keep those rates the same with the values going up the way they are.
Well, you also look at, over the years, Corsa has become proactive with their incentive programs and are out there trying to prevent claims as much as we can. We know we carry a fair amount of risk of damage, especially with patrol cars. It's the nature of the beast, but when you look at everything else overall, Corsa has been very proactive, and that's how allow us to in values to increase, but the premium decrease.
Yeah. Yep.
Yeah, that's a good point, Glenn.
Yeah, I totally agree, Glenn. And with that statement, Glenn, I'm glad you brought that up. I mean, we're always looking, too, to add any risk management services that our members might need. So please, if you're running across something in your county that you think, oh, this is something Corsa can help us with, because I'm sure other counties are running into the same situation, so please let us know, because, again, we're always, each year we try to implement something new. And, we could use some help with some ideas too. So, yeah.
Well, I'm glad you asked.
I had something in mind.
I hadn't planned on, I was saving that, but it was a great segue, Ally, into that. I mentioned, I think the last time we were able to get together for the Commissioners Conference, I mentioned that we're looking at setting up a data center.
Yeah,
And we are in the process of doing that right now. And we have one of the county governmental entities that wants to come on board and store their data there.
Okay.
I'm not even sure what question to ask, but if they're storing their data on our equipment, which just on our servers alone there are 3 backups, and within the next month we'll have a data recovery site off-site somewhere in the county where we have an exact mirror of every hour of our server. Which will be air gapped, so it will not be on, so if we get attacked here, it's not going to touch that the recovery site.
Okay.
I think I got my question fleshed out. Is the data that we're storing for someone else, will that be covered? Or how is that going to have to be handled?
Okay, yeah. Let me check on that for you. Great question. So, yeah, let me check on that for you, and I'll definitely get back to you. So
we're not trying to push the envelope, Henry County.
I'm sorry, Glenn?
I was going to say, Henry County, we're not trying to push the envelope for anything, but...
No, I didn't think that at all.
Good.
Yeah, no, let me check for you, just so,
and this,
just forward.
Yeah, and this could go, multi-county. Possibly. It's been talked about, but we're coming into the election, we're going to see a changeover of some commissioners, so kind of in a sense the discussion would start over again. But, looking at insuring something like that.
Right, okay, yeah, let's just check that out for you. Who's the entity that is going to come on first?
We're in a public meeting, I'm not going to say. I'll leave.
Oh, okay.
I'll let you know.
No, you're fine. No, I apologize. No, you're fine. Okay, yeah, but let me check that out for you and see.
Okay,
Okay, yeah, I'll get back to you.
okay.
Okay, so, moving on with the reports, you know, as I just mentioned, we, at your course, try to return member equity as much as possible that we can in helping our members. So over the last 10 years in dividends, you have received a credit of $184,000, and that shows up yearly on your premium invoice. Then we also have the loss control incentive program, which over 10 years you've received $44,000 in credit. That also shows up as a credit on your premium invoice. But kudos to your loss control program. I'm assuming Nick is still in charge of that?
Yes.
Okay, and just want to give some kudos. This, the loss control incentive program was put together to help educate our employees, but also hopefully return a little bit of credit on your invoices, and so it's a win-win for everyone. But there's also some work that goes into it each year, and we definitely understand that, and so I appreciate Nick's help in putting that together each year. The reinsurance credits, and this just started 2 years ago. CRL, our property reinsurance carrier, decided to return a dividend to their members, so we received a dividend. And so what Corsa decided to do is just return that credit back to our members. So we received a credit of $1,300 in the last 2 years. And then a couple of the risk management services that Henry County has participated in, the Facility Due, which is the maintenance software program. $16,000 is from Corsa's portion of reimbursement. Corsa reimburses 75% of the annual invoice, and then the county picks up the other 25%. The sheriff, we had grants and subsidies offered to our members for body cameras, and so the sheriff participated in that grant program and received credit of $5,300. So over the last 10 years, Henry County has received a return of member equity of $252,000, and so really looking at it, you've got a year premium free. So look at it that way.
Yeah.
I really think that these numbers highlight, again, just, what a pool can do for its members. And we appreciate what Henry County does for the pool also. You guys are a great fit, have always been a great county to work with, and, we just want to thank you.
Good.
So then the next page is something that each year is our little green box that highlights the risk management services that Henry County used in 2016. And so we run your motor vehicle reports. We ran 265 last year, and that's a yearly run in new hires. In September, October, we decided to move to a different platform through Samba. And so actually they do a daily run for us instead. And so we're hoping that will help our members also be notified in a more timely manner if for some reason somebody shouldn't be driving for the county. So hopefully that'll work out for everyone. Corsa University, which is our online courses that we offer, there's 300 topics in the library, anywhere from HPS to defensive driving, there's law enforcement. I think this year I see a little uptick in those course numbers just because we can't really meet in person for the training. But with that in mind, if you have an elected official that, comes to you and they're looking for a certain course that they just can't find, let us know because we can always ask our library in detail. This reflects the body cameras again, which we just talked about. The sheriff just did that in 2019. And then we also sent deputies to some LLRMI trainings for law enforcement. And so we're just glad to see that he's taking advantage of those educational seminars also. So now, just to end on our usual, this is our lovely map. We have 66 out of the 88 counties, and, if you are, in a meeting with anybody that is not a close number and would like to talk to us, you pass their name on to either myself or John Brownlee, and we'd love to sit down and talk to them. And with that, the only thing else that I know John would say if he was on a call, he's on today, but I know he's been wanting, with budgets coming up, he wanted to let everybody know that he is going to work very hard with the board at the retreat in a couple weeks, and trying to, what they can do to at least try to keep next year's renewal somewhat, can't promise totally flat, but at least hoping not to be too high of an increase, so just for your budget purposes. Also, if the sheriff comes to you, we know that we don't know through the federal or state government, or it's going to trickle down to the county, that there's going to be some, obviously, like community policing requirements, such as for new hires of deputies, some pre-employment testing, evaluations, and we already have groups that will cover that cost, but we just want to let you guys know that it will still be available going forward. And then there's also maybe some other things that John Brownlee and Frank Hatfield are working on to try to help the sheriff with any regulations that might be coming down the pipeline, and so to help the counties out financially in those respects too. So I just want to let you guys be aware of that also. And then with that, this is my presentation. Again, we love Henry County and just appreciate everything you guys do for Corsa and for our members.
Ellie, did I hear you correctly say working hard associated with John Brownlee?
You did. He really has been working hard.
He told you to say that, didn't he? We know.
Yes. You know that was strict for me.
Yeah, no doubt. I don't doubt that. Yeah, let all of Northwest Ohio counties know.
Yeah. And I'm working hard.
Yeah. We had a lot of fun with John.
Yes, we do. And he's a good sport about it.
And Frank, he says, we missed him coming up here and teaching some of those classes that he taught.
Yeah.
Because he always.
I know.
He just has a good sense of humor.
Yes, he does. No, and I enjoy working with him mostly now. So, yeah, it was a win for me. Let's put it that way.
Yeah. Well, we're glad, thinking about a year ago, we're a lot better off.
Oh, yeah.
A lot better off. It was just, we saw a situation where the members had to take control, and it's ours, and I think we have a very solid organization, very solid leadership, and really, we had a good board, but there's been changes. We have a good board again, so it's the future's exciting.
Yeah.
It is exciting, and we appreciate everything the members do for us too, as a staff, and we think in going forward, even as of today, everything is just, we're moving forward in the right direction. Everything's going well, so we appreciate it. Thank you.
Okay, well, good.
Okay, so everybody good?
I think we're good, Joe.
Thank you, Ellie.
Yeah.
Questions? Sure. I hate to butt off, but I do have Williams. Okay. Have to be here. So, if you need anything, let me know, but I'll get back to you on the data center thing too.
Be sure to greet Commissioner Hilkert and Commissioner Rummel from the Henry County Commissioners.
And Davis.
And if you kind of hesitate for a while on Davis, that's fine.
Yeah.
Don't drive him nuts.
Yeah.
Hey, thanks. See ya.
Thank you. Good day.
Yeah, Cameron. See ya. See you, Cameron.
Thanks, Ally. Yeah, thank you, guys.
Thank
Bye.
you. That being said.
Oh, you got that down, I knew you were, she was, with her eyes open.
Yeah.
You can tell it is kind of crying.
My nephew does that.
Does he?
Jerry,
Yeah.
Does what?
just with his eyes open.
She's.
Sleeps with his eyes
Not all
open?
the time,
Yeah,
yeah. He'll go there and he's like, oh, gosh.
Yeah, that would be.
yeah.
Would.
Yep.
All right. Let's see what we have. How about we do some budget adjustments?
I got it, it was off this morning.
Because I was just getting ready to ask you, you must have went to get them. So to see if you pop that out full screen. Which you could, I think you should be able, would have been able to, yeah. This was go to meetings item.
Yeah, for sure.
I did convince Ari Office on Aging to use Zoom.
But do they use GoTo?
They were started out with Microsoft Teams.
Well, we gotta promote more smoking, that isn't enough money.
I know,
Yeah.
that isn't a lot. That's good though.
Yeah.
It'd be nice to see zeros in there.
Yeah, right.
All right, would there be a motion to approve budget adjustments?
We'll make that motion?
I'll second.
Okay, Christie?
Jeff Myers?
Yes.
Al Huffman?
Yes.
Glenn Miller?
Yes, this resolution is approved.
Geez, Rover must not have lasted very long. Was he working that very long ago?
Yeah, he just went in Monday, Tuesday.
When did he pass, and just recently?
Apparently.
This morning it sounded like.
Yesterday, I think.
Oh,
I think it was yesterday.
Yeah, yesterday,
Yeah, good, you don't want to suffer along with that crap.
No.
Suffered enough already. Okay.
I keep thinking of some of my floaties. Right.
COVID lever glass, vaccine purchase.
Did you say there was lever glass on there?
Way at the top, right there.
That is for, it's only 350, there should be more.
This is.
You know, there were a couple different,
What, 3 different offices? on
Yeah.
there?
Yeah. Probate, that's for the door. That's for the door that, was broken, the exit door, because it broke the hinge.
Yeah.
So that wasn't bad. To get the hinge replaced and usually was bad.
Yeah. Okay.
I guess what that is. Aluminum board. Oh,
They're gonna be meeting next month.
Health Partners.
Oh, that's not around there.
Mm-hmm.
mighty loud they are.
I was thinking it was next door.
Coming from heaven.
That's a weird one.
There's the other one for the lever.
Well, there,
Yeah, that'll be courthouse.
There'll be.
Clerk and Board of Elections. That's CARES Act money.
yeah. Okay. Well, they created this.
Oh, that looks like, we get the backpack sprayers.
We're at, I'm right there, yeah.
Go ahead and click on that.
This is expensive as they'll get out, aren't they? Of course, one thing with them, they're $1,600. What is that, extra batteries or something?
No, there's 3 of them.
Yeah.
Supposed to be 3, they just,
Oh, I see, okay. Who's all getting them? Courthouse gonna have one?
Commissioners. I'm pretty sure they. Are they like the Ghostbuster ones?
kind of, yeah.
Yeah,
It's the backpack version of the handheld.
yeah,
Right.
it's battery operated, it's got an electric
And,
component.
it's the atomizing part that's
Right, that's what,
pricey.
yeah, that's what makes it
You can buy a
expensive.
backpack sprayer at,
$50.
yeah.
For a crank one, yeah. Yep,
They don't have to keep
Over the
refilling it,
fines.
do they?
What's that?
They won't have to keep refilling it.
No.
well, you have to fill it as many times, but you have to pump it all the time to spray. And I don't think you can get the type of pressure on them that these would produce with for the atomizing spray. I bet you that's why they're expensive. Whose are these for? These,
Be out here, but I don't know why we're paying for it.
yeah,
That's what it's done.
We've got money spent that's out there, we have nothing to show for it.
right. Attached to the quotes for lever strap, you have to make quotes equal, we need to double the door controllers.
That Tracy's right.
I don't know.
Yeah.
$695. Yeah, why are they activate medical? None of this work has been done yet. Why are we paying for it?
Yeah, why are we paying the lever class stuff when none of the work's been done?
I'm not sure.
Who authorized the payment?
No one really. I just had it, and so I submitted it.
Okay, from here on out, we've got money, we're paying people money and have nothing to show for it.
Yeah.
So,
I mean, I can hang on to the check
yeah.
until
That'd
they
be
come
good.
in, if that's
Yeah.
how you want me to do it.
Yeah, yeah. Hang on, check.
But will it be done within, when the checks are good for, it has to be done in 90 days, don't it? What's it say, it's 60 or 90?
I have no idea.
I've never really looked at it, other than just
And it's
making sure that
90 days.
mailing address is correct.
Yeah.
Yeah, just hang on to the check until they're installed.
Yeah, because we've paid for stuff that we're not,
Right.
we've got pallet racks that are not put together or installed.
Yeah,
We've got,
Yeah.
thermoscan units that,
one's
We
here
don't have.
that we don't have, yeah,
well, that should have been here 4 weeks ago.
yeah.
Yeah, so,
Yep, I can
you
do
know,
that.
once the PO's cut, we'll get, and then we'll get the
Yeah.
final invoice. And
See, there's the scanners right there.
Are those in, do we get them yet?
That's from Pat.
That's a different one, that's.
Yeah,
That's
that's
not-
not
that's
us.
already-
Not us.
They want their own.
No, I mean, is it going out here right now?
Those are from Carl Office Solutions.
No,
No,
they bought theirs from somewhere else, Office Solution.
That's JFS.
And we don't have to deal with any of the problems.
Right.
It's, you know, they've got their own
This is JFS, yeah.
tranche of money.
Yeah. Okay.
So it looks like we don't have to, because we targeted a few of them.
Unless you wanna hold off on them, if you don't wanna approve them, I can wait till the finals come in. Cause it could be different, I guess, I never thought about that.
is it just that one?
Yeah, because I waited on Mel Winter's, the office, I waited on that for a check, I mean, I got the PO written, but not,
Well, it's fine, we need to have a PO so that
yeah.
we can proceed, but as far as paying until we get a final invoice,
Yeah,
okay.
yeah, so if you wanna decline them, I'm completely fine with that. That might be easier, because if it comes under,
If it's not the exact amount, I mean,
yeah,
when they do it?
So it's gotta be.
Oh.
It's gotta be.
What did you say to him just now? I missed that. Say it again, I missed it.
You can't do a change order on this. On
Yeah,
the CARES Act, you can't do a change order. If there is a change order, we pay it out of the general.
yeah. Or they eat it.
Yeah.
okay.
Well, and I think these guys know that coming into this.
Yeah.
They had to bid it correct, you know, so.
I would, go ahead and that one deny or redirect back to Anna.
Okay.
I don't know, can you just leave it sit there?
Or can-
You know, she'll probably
Well,
call.
I can
the
just hang on
danger
to
of
it.
leaving it set there is that it gets paid.
Going up, it's up,
Unless you just want me to hang on to the check.
we're right there in the middle,
This one?
up to.
That one?
Yep.
Was it, is that the one, wasn't it more than that?
It's that one, and then the one, and there's another one that's like 30,
35, around 34,000.
And down at the bottom, so this one
That one,
and this one.
Yeah.
Yeah.
Okay. Just redirect them to,
yeah, because
Well, if you redirect them, they go to Liz something.
we can tell them where, should be able to tell it to go back to Anna.
we'll find out. Let's see, we go here. And,
Up there,
okay.
Commissioner's entry.
Right there. Something we've never done before. This is new.
What's that?
We'll-
Find out.
Yeah.
This you, it may go out into VIP land.
Okay, so what do I put in here? She already knows.
You already know.
Yeah, you already know.
Waiting for final input?
There.
We already know.
Whoops,
Yeah,
two.
With that, with paying, you kind of lose your bargaining,
Yeah.
unless a company is going to call today and tell them, we want our money back, because your equipment doesn't work. Now, that will get action.
Yeah.
What's that?
This tattletale stuff doesn't work. The unit is defective. When you turn it on, it has a clock.
Yeah.
It just sets, whatever time it boots up, that's where the clock stays.
Oh, shit.
What is that for?
That tattletale,
Well, that thing's sat in there long enough, it should've,
yeah. Could you look that up and get the invoice, copy of the invoice for me, please?
Yes. Yep.
So I'm gonna call the president. Just, there's no sense in, it's easier to start up and come down than it is from the bottom to go up.
Yeah.
Because people don't wanna kick you up on the way,
Yeah,
because that flags attention.
yeah. The rest of these are okay then, I think.
Yeah.
Yeah.
Would there be a motion to approve then and now?
I will make that motion.
No second.
Okay, if there's no further discussion, Christie?
Jeff Myers?
Yes.
Bob Hesta?
Yes.
Bud Miller?
Yes, then and now been approved. Thanks, Anna.
You're welcome.
Okay, we have, just, you can go ahead and just read it.
It is in the matter of payment to American Pavement for 2020 microsurfacing program in the amount of $140,520.27.
Okay, would there be a motion?
I will make that motion.
I'll second.
Okay, discussion. Does that final that project out?
I don't know. I think so, but he didn't say, he didn't put final on it, so
Okay.
sometimes we'll put final on it.
Well, it is, that microservicing is something we did approve.
Yes, it was.
Yeah. Okay, is there any further discussion?
It does say final on here, yeah.
Okay.
I know, okay.
Did.
Okay. If there's no further discussion, Christie?
Jeff Myers?
Yes.
Bob Hesta?
Yes.
Bud Miller?
Yes, this resolution is approved. Wonderful. Do you have anything else for us, Christie?
I need you to sign this RC2, chapter 4.
Okay.
I think there's more things in there, so.
Okay. Do you have anything else? I'll note that we.
I can listen.
Okay. Bob, got anything?
No, other than the story I told you.
That was a good story. You should call Tom.
Yeah. It ain't over yet. It ain't over yet, but telling the story.
No, but this was all on us.
Yeah. It don't go away, buddy, it don't go away. I'll tell you after a while.
I'll tell Christie.
I'll tell Christie after a while.
Even me, even Vicky.
Yeah. It's called Vicky.
All right, imagine this metal.
He's back. Oh, he's back. Yeah.
Well, it's kind of a whole different approach. This
Yeah.
is, you'll have to have Bob tell you.
Yeah, it's quite a story. But like I said, I told you guys that in about 8 minutes, it's 45 minutes.
Yeah.
Truck's sitting there running, I'm waiting, I keep checking stuff, walking around, he's following me around, telling me the story. Come on.
Yeah. Do you have anything, Jeff?
I cannot top Bob's coming story, so I'm not gonna try.
If you need a Trump fence flag, They're selling at the taco stand there by the bridge.
All right.
Jeff said Woodruff's out south of town have them.
Okay, I bought one already, a long time ago, he said, hung it up yet, gotta get it up. Told my wife.
I stopped at Republican headquarters late yesterday afternoon, because I forgot to get a Diana Watchman sign. My front yard's just going to be county this year. I told her that some years I've done, whoever wanted to put one there, good. So I had Republicans, Democrats, Independents.
Yeah.
It was confused the neighborhood.
Yeah.
Which was fine. And then, gone completely, state of Ohio.
Yeah.
But, so it's just county offices this time, and probably get a Trump flag. I don't have anything. I did send you the notice that, we're just waiting for the governor's signature.
Yeah.
For, House Bill 614 that had Senate Bill 357 amended to it.
Right, yeah.
And so it was great they found a vehicle
To move
do what they wanted to do.
Yeah. Yeah, that's,
Because it really had nothing, since there was always trying to be something for that House Bill 6 that repeated.
yeah,
This had nothing to do with it.
yeah,
Nobody, even, I watched some of the last 45 minutes of that House hearing. Even, the Democratic caucus members were, a couple of them had good questions, and just wanted some clarification,
Yeah.
since they're
Yeah.
kind of changing the formula.
yeah, yeah,
And, I haven't calculated out to see if we got hurt or if we came out better. In any case, the bottom line is, we have come out all right,
yeah,
because this is not using our general revenue funds to do any of this stuff,
yeah, and that's,
so.
and we're gonna have more than enough, the way it sounds now.
Yeah. I would like to, personally, Joel Miller asked me yesterday, that, are we going to be doing another round of, business grants? And I said, I'd love to, let's see what we can,
Yeah,
but we'll need to begin to move on that, probably next week to revise our grant requirements.
yeah,
And this round, because of the timeliness and, Kevin typically wanting to close
yeah,
stop
mid-December,
payments
Yeah.
at the third week, beginning of the third week of, December.
yeah,
That's probably one of the requirements on the business grants will be, you will turn in all your stuff that's required when the application comes in.
right,
If not, it's put off to the side. The committee deals with the ones that have met the requirements,
right,
and then if there's going to be extra money, we
Yeah.
do the hand-holding. We just don't have time to do any hand-holding this time. And it's also being discussed about possibly opening it up to nonprofits.
yeah, I saw that. Would that include like service organizations then?
I don't, well,
That's a
Like that kind of stuff.
we're looking at reimbursing for PPE,
Oh,
that
okay,
type of.
that kind of thing, okay.
Yeah.
Because like our Legion lost a shit ton of money because it couldn't have,
That would be revenue replacement.
yeah, that would be revenue.
Yeah.
So I saw one in there, I'll ask you.
By the way, Joel's gonna be bringing Fair Lady Justice
Okay, press on.
next Tuesday.
Yeah, I called him and he said,
I was excited.
Yeah,
yeah,
I was so mad.
that was where he can't, so many movies you find parts of bodies and garbage bags, and here he comes in walking with his garbage bag, and oh my. Yeah.
Especially when her makeup was done.
It was amazing how good she looked.
yeah.
Other than she had a few holes in her head.
Oh, did
Mm-hmm.
you?
Yeah, I called him and asked him if they would do a, radio catch up, and he said, well, we're coming in. He goes, we'll talk about it then. I said, Andrew said that. He goes, we'll talk about it then. He goes, one of us will do it. Yeah, he said one of us will do it, so.
Andrew called, I saw his name, I go, where's the plan? Let's see if we can keep it up.
They had that one ready, didn't they?
Yeah.
Yep.
Hey, I got a question. On these, when it says periodic billing, it don't have to have a date in here, right?
No, because
Okay.
it's not disposed of.
Yeah.
It's still on.
Still ongoing.
Delinquency or.
I've been okay in,
Or something.
I've been okay in them. I just wanted to make sure in my mind that it was
Yeah.
correct, yeah.
When it's finalized out, it could even be next month that case is closed.
Right.
There will be a disposed of.
Then, yeah.
Because a number of times we've run into that.
Yeah.
And asked that question.
You do it, and you do it. and-
Or we've missed the X and.
Yeah,
the
right,
Y.
right, yeah. And, it must have been the one I just did. Now I gotta do this one yet. Is there any more in there? Yeah, crap, I'm
Does
looking
it
at
under
your
go to
pick and
JFS
choose.
then? Is that big guy?
Does it say JFS on it?
No, but I thought-
That's ours, they bought theirs from somebody else.
I thought Anna said that was replaced JFS or something.
She might, we had some on this order that went to Zorpro, the company that made that one out there. We're going to put up some up in,
Where else?
the Han Center. And apparently,
Oh,
they're able, we're not sure what's the holdup. They have been paid for, which is, is a no-no. So I've got to find out. I don't have enough information. There's been a couple people on staff that have talked to the company. Don't have enough information of who they talked to, when they talked to, and what was promised. But that should have, when we sent that one back, they said it would be here in 2 weeks, and that was 4 weeks ago.
So where's this one going?
I don't know.
I mean, like.
Next door.
Okay, that's what I.
We don't know where it's, we don't know the final resting place.
Uh,
Yeah.
It is heavy, I don't know,
Is it?
yeah. I mean, I tried to look, I thought I could.
Let's look at the forklift.
Will it fit in the door?
You probably can open both doors and get it done.
The forklift won't fit.
Oh,
It's got a triple
Oh.
mast on it, so it's higher. It's for, set up to be used like in a warehouse, higher ceiling, area. If we had garage door come in here, it probably, if the ceiling was always high, we wouldn't have any trouble in here. Okay, as to keep, that is the one that you've got your mouse on, that is CARES Act purchase.
Okay,
It's for remote access.
okay.
The next one is,
Laptop project, that's cool.
we get bill. Don't pay those.
Neither one?
No.
We're gonna pay these. Now, what about those body scanners? Oh, that's not our.
Scroll down, Bob. It's gonna be down, higher,
Up?
no, down. It's gonna be the higher numbers. Anything, go back up, it's marked $849, IT equipment.
Right.
Yeah.
Unmark that one. There's another one up, $715.20, next one up.
Okay,
There you go. Unmark that one.
okay.
Because if that's a prepayment,
That's JFS.
What's the 334? Oh,
That's internet.
That's JFS.
I just
What about
wanted
that
to leave
one?
them sit there.
What about that
I
one?
told them not
well,
to,
you can leave them sit there.
'Cause then
Well, what happens when we go back in sometime, forget,
Yeah.
and it's happened before.
Yeah.
That's JFS. What about, there was one here, that one.
Yeah, click that one off.
We can look at it before we, if you want to make
Let's
sure.
say COVID sign and all that.
Yeah,
Yeah, just,
but these here, like that one, that's JFS.
Yeah, those are all Pat Elias and.
Yeah, those are all JFS, so they aren't all, well, that one, no, that's not the floor signs. Okay.
Ohio Means Jobs is what that one is.
Oh. All right, so I'm gonna approve those.
Hey, Anna, could you come back in? Okay.
This one we wanna look at, right?
Oh, yeah, Anna's coming in,
And that was for a Dell monitor.
okay, pay that one.
Pay that one? Okay.
The ones for Dell.
That's for family court, anyhow.
Because some of that is CARES Act.
I wasn't told that, I guess.
That the laptops, we don't have an invoice for that.
Which laptops?
We'll get work down to it.
Those invoices come straight to you or just Christopher
Okay.
to you?
Christopher brings them to me.
Is this it?
You probably need to tell him to write
Just open
something
that
down
one
there.
up.
But see, that, when he brings them to me, then I request for payment from family court, so.
Yeah, that.
The family court one I just sent through,
That's
yeah.
fine, there's some larger ones.
Okay, now there's some outdoor cameras.
Yeah,
The CARES Act.
Board of Elections, are they here?
And not movable, because they'll
Yeah.
have to be.
They are, okay, then we'll go ahead and okay that one.
I'm pretty sure they're installed.
Okay,
Ordered, invoice date,
Because there's not gonna be any way you're gonna know if we have.
Yeah, they're here.
okay,
No,
So,
okay.
take a minute to,
yeah. Is it one like 51,000?
yeah, maybe keep it until.
yeah.
But you know what, I'll
I'm
keep
gonna
them
okay
all
this one.
until someone tells me to mail it out. Because that way, I mean, because I keep a copy of the invoice and with the purchase order paper, and then what I do is I stick a check and all that with it, and then I mail them there when I mail it out. So I won't mail it out until I'm told to.
Yeah, we've got, well, at the danger of,
That's
Lord,
Board of
just
Elections.
don't even have the checks cut.
Yeah,
So as far as the system's concerned, that money's already spent when it's encumbered,
Right.
so that's
that one's good to go.
that's not available. Yeah. Because we do have an account with Dell.
Okay, this one's good, that was Board of Elections. It was computer stuff. It was Board of Elections.
already know.
What you said?
Okay,
So
now,
what
this
do
one I
already know?
got, what, okay,
You already know.
these two, what are we gonna do with these two, I guess?
Send them back to Anna.
Back to Anna, okay.
Yeah, I guess you already know it.
She must, you know.
Yeah, she must see all of those too. Did that come back to you when you're working on?
I have not looked at that yet.
Just curious.
If it isn't, it's in VIP land. Liz will find it.
She did, she already called, and she goes, what do I already know?
And just, that's a reminder, that's a mental reminder, yeah.
I did.
Yeah.
And then we'll look at this.
Should have put in parentheses, not Liz, not you, Liz.
No.
Oh, I saw that one, it was okay. All right, I'm all done.
All right. If there's nothing else to come before the Board of Henry County Commissioners, Hearing nothing, would there be a motion to adjourn?
I will make that motion.
I'll second.
Okay, Christie?
Jeff Myers?
Yes.
Al Hassett?
Yes.
Glenn Miller?
Yes, we are adjourned at 11:04 a.m.
Yeah, it's a tough morning. And it's not done, I gotta sign all that stuff. Jeez.